if you're in crisis and you're up against the wall and you finally decide you want to have therapy, then you want help right goddamn now, right? And so you're going to be frustrated potentially with a therapist who then wants to ask all these questions about your history, your family of origin, your educational history, your work history, your drug use history, prescription history, medical history, sexual history. But that data is crucial because if you don't gather that data and then you just move immediately into therapy, and then 6 weeks later you find out that there's something in the history that bears on this and you're on the wrong course, you're wasting time. So for clients out there, for people out there, remember that when the therapist is asking those questions about your history, they're doing their job. It's a very, very important part of the clinical process. So start working on what is the immediate presenting problem to get to some sort of stability, something you can give to them right away that can start the process of unfucking what's going on. But don't forget to take the time to circle back to a thorough rendering of the history, because in the absence of that history, you're flying blind, right? So I think people may, in their misunderstanding of therapy, saying, oh, here we go, we're going to talk about my childhood and we're going to blame everything on my parents. That is not the purpose of taking a history. But I'm going to tell you what, I want to know about your parents or your family of origin, not because I'm looking to assign blame to them for why you're struggling, but in the framework, a lot of your rules were learned then from all those agents of socialization, parents, teachers, coaches, clergy, organizations, institutions, right? If I don't take the time as a clinician to understand the history, then I don't have the time to look at all the rules that are in play. And I can't teach the client about the rules and help them find the rules until we go there together, right? So that's another very important thing that people may misunderstand, especially when they're up against the wall and they're in a crisis kind of situation.